not just talking about worrying about the radiation causing the cancer. I'm talking about the fact that they had the radiation and it didn't work, and they have that recurrence, whether it's 10% or 15%. Those patients after radiation, their tumors just seem to take on a much more aggressive infiltrative nature. At least that's been my opinion for the ones that we've treated. And there's a lot of radiation dermatitis that you also have to deal with. So the tissue is not that great tissue and makes the recon a little bit more challenging. So I think this is just an example of, yeah, when it doesn't work, you could have, a really challenging um, recurrence and a very difficult case. And the question is, Mohs, quote unquote, is the gold standard. Radiation certainly is indicated for patients potentially who can't tolerate surgery. But I do think we have to break down, what they're describing here with the HDEBT versus the more just superficial radiation that we're hearing a lot more about, and that's being promoted a lot more, which is more typical than, that's not quite the brachytherapy. So initially, that was the big issue that the American Academy of Dermatology had to address a few years ago because they were using a lot more brachytherapy.